Hi everyone, welcome to another episode of the NMS Health Talks podcast, our in-house platform to help us tell you what National Medical Stores does and also hear from you. If you have any questions regarding the operations at NMS or you need any clarifications made, please leave your comments on our social media platforms. On Twitter, our handle is @NMS Uganda, and on YouTube, our handle is, or username is, National Medical Stores Uganda. I'll be very, very pleased to engage with you. Today, we would like to talk about all things innovations at NMS. How is National Medical Stores using ICT to better its operations and deliver on its mandate? To help us answer that and more, we're joined by the man himself, Mr. Stephen Chisuze, who is the Chief ICT Officer. Thank you so much for joining us, Stephen.
You're welcome.
I already introduced what you do and who you are, but could you just break it down for us? What exactly do you do at NMS?
First of all, I'm happy to be part of this episode that is going to help us understand the power of digitization and innovation using ICT. I lead the team at NMS on behalf of management that ensures that ICT not only supports the business that we do of procuring, storing and distributing, but it's well governed. It helps us to deliver on our mandate and helps us to manage the risks around IT, and also ensures that we are innovative to face the challenges of the day. That's basically what I do in a nutshell.
Okay, so you talk about managing risks around IT without probably going into much detail. What are those risks? What do they look like? And what are some of those risks that you've managed?
Yeah, risks span a whole lot of things, as you know. Many of you are aware of what we call cyber security. Cyber security is a big word to cover all types of risks that relate with the people, attacking systems, injecting into systems unwanted software which can disrupt operations and cause a lot of distress on operations, on the normal flow of things. So that's part of the work that we do to manage that risk of cyber.
Okay.
Then there are also risks related with the environment that we operate in. Power surges, power fluctuates, as you know, on a daily basis. So we put in place systems to manage that, to avoid corruption of data, which is also a big risk that we face. When we rely on digitization, a lot of our data is in the digital form that is easily susceptible to corruption. So when you need it, you find that it's not usable, and that can be quite a big challenge. So on an ongoing basis, that's what the IT people do in the background. Yeah.
And you also talked about helping the organization in, with innovations around procurement, storage, and distribution. Could you just break down for us how that looks like? Perhaps in procurement, how does that look like? Innovations in storage, innovations in delivery, just for our audience to understand.
The entity that NMS is relies a lot on regulation, and this regulation can be kind of restrictive in the way we work. So you find you need many people to do one task, but just because that's what's prescribed, everybody has to do it based on the regulations. But we find ourselves in situations that sometimes we can improve. And that's what our law requires us to do, to find ways of improving and relying on solutions that are innovative. So that propels us to find digital innovations that can facilitate
how have the operations
processes.
Improved with ICT?
Yeah, of course, we've gone a long way in terms of, for example, eliminating paper in many of the processes that we do, which means that the time that was spent writing forms, while, for example, picking the medicines It has been eliminated, and that adds more time to the picking. That means it increases the efficiency of our work. That means better service to our health facilities.
So how was it before and how is it now? How did it look like?
Oh, it looked a bit terrible. Yeah, you can imagine a facility putting in an order and someone having to drive from all the way, the farthest part of the country, Zombo, for example, across the Nile 2 times to deliver an order on paper and then go back and expect it to be processed. All that is now processed online in the comfort of their Zombo place, and the order gets here the same time an order from Wakiso would get here. So that's quite efficient for now. And then it has engaged more stakeholders at the level of the health facility. In the preparation of orders and plans for the supplies that are needed throughout the year, health facilities have structures. Now you'd find back in the day a health worker who is preparing the quantities that are required for the year could do that whole exercise by themselves. But right now, the system compels them to do it a minimum of 2 people. There's a preparer, there's an approver, but in some cases there are reviewers, depending on the size of the facility. That way, we've engaged more people, impacting on accountability at the health facility level, impacting on the availability of these items, and then tracking of utilization of budget is now done in a much more effective way because of that digitization we have put in place.
So how about on the delivery phase? How have you ensured that there is visibility of the supply chain right from when a truck leaves NMS up to when it gets to the health facility? And again, as a reminder for those who might not know, NMS buys, stores and delivers medicines and medical supplies to government health facilities. So we're trying to understand, how has ICT helped in improving operations in the buying, in the storage and in the delivery? So you've talked about the ordering side of medicines. People would come with hard copies and bring them here, probably get lost. You've talked about the preparation, the budget side of things, and making sure that there's more people looking into the system to see that things are going well. How are we ensuring that the medicines that leave here get to the intended destination?
Yeah, that has also improved in quite a bit, and we find that when orders are brought in from the various places, I gave the example of Zombo. Zombo will place its order at the same time with another facility in the same zone, according to our NMS zoning. At the end of the day, there are so many orders. So aggregating those orders into planned or a good method of delivery using our trips becomes so easy when you have information in a system, because you can group orders going to one destination much faster, separate them from orders going to another destination. So organization at the level of NMS has improved so much that we can see more trucks moving out or being processed at the same time. More delivery routes, different trips, and so on and so forth. Now, when the goods are in transit, our facilities are also facilitated with, within the portal to be able to know which goods have been dispatched and what to expect when those goods arrive. And then once they have been received, again, they can be using their mobile phone or any mobile device. They should be able to check off what has been physically delivered with what the system says. So that proof of delivery is the first step that we've been able to accomplish. And without interference, without manipulation in terms of writing quantities, all the information is already digitized. Now, therefore, we just get the right people having the right code and accessing the right information to ensure that between NMS and the facility, the goods are at their intended destination, and that's the first step. Now, the next step would be to integrate our systems with the health facility systems. And that's work that is currently ongoing. The initiatives between NMS and the health development partners and the Ministry of Health, working along with the implementers of these EMR systems to integrate. Now, that will mean that this physical intervening step will also be eliminated, and now at the dispensing point, you will have information continuously connected.
Sorry, what do you mean by the dispensing point?
Dispensing point is where you go after you have been checked by your doctor or your health worker, and they send you to the pharmacy window and with a prescription. And then the tablets or the vials or the tubes you are given, the ointments, will be dispensed using the system. And that system will deduct from a quantity that can be traced all the way back to NMS. And also from NMS, I can trace all the way down to the final end user. So that's the final leg of the digitization that we are currently working on. Still work in progress, but very soon we shall be able to demonstrate that achievement. And then, of course, the patients will be able to benefit in the way that if I have my patient record in this one facility and I am transferred next week to work in another facility, and I need to continue my treatment at a health facility that is able to handle my issues, that means I should be able to access part of my records directly. And that's the aim of that integration.
Do we know how long this full digitization up to that dispensing point or up to the patient level would take, or it might take?
I think we believe that with all hands on deck, this can be achieved within the next 1 to 2 years. Yeah.
Okay, so you've talked about the different innovations across the 3 stages or the 3 mandates. How do you then think that overall, how has ICT helped in NMS operations?
In terms of our internal operations, we have been able to join up all the functions within NMS. By that, I mean that finance is not operating independently of warehouse and operations. Warehouse and operations is not operating independently of client services, and all of those 3 are not operating independently from procurement. Now, those are our 4 key operational departments that make NMS what it is. These finances we receive from government, they come through finance. They have to be distributed to the health facilities. That happens through client services. And then orders are planned for the year based on the budgets allocated. That's the procurement planning. So you can see 3 modules. Then the warehouse processes these orders based on what it has been allocated and based on the budgets. Now, we've been able to integrate all those internal functions using one system called NMS Plus.
What's that?
And then NMS Plus is an acronym that we have coined for our ERP system. An ERP system is an enterprise level solution that is able to integrate all departments to have one single source of truth, and that is what everybody uses along the processes of their work. The processes are visible end to end. So we say from procurement to payment, and then from order to delivery. All those processes are interrelated and they are co-joined, and they use the same piece of information, one single source of truth. So we have been able to put in place that system. On the client-facing side, We
By
have
client, you mean the
health
the
facility.
health facilities.
We
Those are
have-
classified as clients.
We call those our clients and the districts and some stakeholders. We have extended this system through a portal, and that's the portal I was referring to. It's called NMS CSSP. So CSSP is the short for Client Self-Service Portal.
And what does that do?
That one helps to consolidate all the ordering programs that expect items to pass through the government system that NMS superintends. So all of those programs are already programmed into the portal. So if you want to order for reproductive health items, you simply go in the portal as an authorized user, select your reproductive health module, and then everything will happen. If it is about TB, same thing. HIV, same thing. Anti-malarial medicines, same thing. And the government programs, same thing. So many programs are all there. So we have been able to integrate that, and that's where the client's point of interface is with us. And it also handles the receipt side of the goods.
Okay. So what's the next big innovation for National Medical Stores? You've told us how your internal processes are intertwined with our mandate or the NMS mandate. So what's the next big thing?
Small one. Two big things. The first is to ensure that we work together with government to integrate our systems so that we support the citizens, the beneficiaries of government services, to be able to use information that is commonly acceptable through the system. So for example, if I need to identify myself at a health facility, must I go through a new accreditation process at each health facility? I think it's not very wise to do that. So either I use my national ID or an identifier that's accepted across government to access services just the way I access them in the bank, I access them at any other place where my identity information is required. So we want to push that, and we are continuing to push that. I already gave a hint on our integration with the EMR systems at the health facilities. So we want to extend that further to different areas so that we help our people to get services in the most effective way. That's the first big thing. The next is for us in government and decision-making level to start to use the data that we collect, to use it productively, to be able to do analytics on it and make decisions that are accurate, that support the aspirations of the end users. If we are talking about shortage of information, or rather of medicines, how do we quantify that if we cannot account for the last tablet? I think by integrating and streamlining all our systems, we are able to put all this data into a few places, look at this data and identify gaps, and then make the appropriate budgeting, and then do the right controls on the usage of those medicines, and then we should therefore be able to extend these benefits to the citizens that receive the medicines, but also make better use of our money so that we do not buy what we do not need.
Okay.
Those are the two big things that we are trying to work on.
Obviously, you deliver medicines across the country to different health facilities, over 3,000 health facilities. But how do you ensure that people know that these medicines have actually reached the health facilities, and basically ensuring that there's accountability and visibility of the entire delivery process?
Thank you for that, Sheila. I think I'll start with the adage that information is power. So we recognize the fact that as we do our work, we collect a lot of information. But traditionally, this information has not been out there to the people who need it, for them to be able to communicate or to query the challenges that they seem to see across the sector. So a lot of times we've had different leaders, politicians, citizens complaining about lack of medicines. But when you hear such a message, that message is not directly connected with another message which comes from another entity which says government has released so much money for medicines. So in between there's disjointed flow of information. So what we came up with is we realized that the level of management that if we are able to alert these leaders when we deliver, and then we cascade further, we alert the community leadership, we alert the leadership of the health facility, we alert the political leadership within the district where the facility is.
How do you alert those leaders that you're mentioning?
Using technology. And that's how we came up with our tool called Delivery Monitoring Tool. So it's a platform where all the stakeholders that we think are either impacted or influenced or are affected by the medicines that is ordered, that is delivered, that is distributed through NMS. We profile them and put them into that tool. And at every stage of our delivery, they receive alerts on their phone. And they are able to know that an order that was made like this period has been processed at NMS and has been dispatched and has been delivered and has been received by so and so. And in the case of a complaint, there are contacts on all the stakeholders that have played a part in that. So with that wealth of information, you start to dispel the original problem, where at one point we know government has released money, at another point we don't know what happens.
Is this information open to the public? Can any ordinary Ugandan receive that message? Or is it only for leaders?
Yes, as long as you go through the right channels. If you are associated with the district, you can request through the district to be able to be added onto that platform. If you are a certain level of stakeholder, you're able to access that information directly requesting NMS, and you're added onto the platform. That applies to MPs, district leaders, ministry officials, and other key stakeholders in government, like Ministry of Local Government, Finance, and others. Those can go direct to the system. But as normal citizens, usually citizens are grouped together in civil society and other sort of groups. They can still gain access to that information, and they'll be informed as and when these processes are taking place at every stage.
Okay. As we wind up, Stephen, what are your parting shots on how ICT has improved the NMS operations, and what next we can expect from your good office?
Like I said, two big things we are working on. Those are at really a high level, but we believe that as they cascade, they affect all of us. So we, of course, urge everybody involved with ICT to always have those in mind. Without integration, usually that system starts to suffer as time goes by. When you integrate, you share common information, and that information becomes useful to the others who may not have to recreate it, but start to use it as a baseline to also grow their own innovations, but also to give you the necessary feedback that you may not want to duplicate. Then the other thing is the data. As we rely a lot on digital, let's try and start using data and get insights into what this data is all about. That helps us to make better decisions and it continuously improve our internal processes. But also, we need to think about the security. Security is key. There are challenges with the use of digital that are known now to quite a lot of people. I think as far as, rather as recently as last week, we are all aware of a huge disaster that happened in many countries in Europe and America, where main ICT operations of different players like banks, airports, restaurants, distribution chains were impacted by some security flaw. It was not even an attack, but an upgrade to a system that caused all this outcry. And to get it back has cost lots of money. So at our own levels, at the level of NMS, at the level of the country, it's important that we always have security in mind. What the IT department offers you is that free consultancy. If you're in doubt, you're not aware, make a call, write an email, check on us. We can always tell you from a better standpoint than the ordinary people. That's very key. So keep safe as you use your digital. On behalf of management, but specifically ICT, let us continuously use the IT solutions, the innovations, to increase our transparency. Let us be deliberate to show people what we are doing using technology. We will support you where you have limitations to further this. This idea of the podcast is part of the transparency that we are talking about. Because this podcast can be played as somebody is driving back home, they are relaxed on a Sunday. There's a lot to pick from here. The information we have shared and other people are going to share. This is use of digital to increase transparency. And accountability follows closely there. Accountability is when you now follow the money. Follow the time that we have been paid for. And follow the resources that we have been assigned. Again, using digital, this can come out. And then of course, knowledge. We need to know what happens at NMS. Lots of people do not know about NMS. They mistake us for NDA. I'm sure, Sheila, you have already clarified that with a lot of people. It's because NMS was not visible. But that visibility is important. And again, using digital, we are able to continuously show that. I thank you.
Okay. All right, that was Stephen Chisuze, our Chief ICT Officer, or as we call him here, Chikto. Thank you so much for tuning in yet again to this episode. Please feel free to leave your comments and concerns and questions and clarifications, and we'll be able to address them in our next episode.